So major factors that will often affect whether or not a patient with diabetes is readmitted will relate back to their blood glucose levels, how high or low their blood sugars are. If they're having nocturnal hypoglycemia, that's problematic. So again, when their blood glucose is dropping low when they're sleeping. So we want to make sure that the medications that are on board, coupled with what their efforts are for dietary changes or modifications, getting them more physically active if they've been not. How do you balance that triad of where's their blood glucose, how are they eating, and how is that affecting blood glucose? Are they active, and how is that affecting blood glucose? The other thing to consider is, as I alluded to earlier, many patients have had diabetes already before diagnosis, and so it just depends on their age. Age will become a factor at how aggressive we might be, or actually the considering of an elderly patient less aggressive, because that can end up in hospitalizations. Certainly patients with type 1 diabetes are more vulnerable to things like diabetic ketoacidosis, which again requires hospitalization. Dehydration can be very dangerous. So depending on the other patient parameters or factors that might put the patient more at risk. And again, we always want to consider complications of long-standing diabetes. Patients often suffer from kidney damage to their vision, obviously still very much contributing to amputations. So with long-standing diabetes comes complications requiring hospitalization.